I thank you, Chair. Zimbabwe aligns itself with the statement read by Guinea on behalf of the African region on integrated people-centered health services. We note the proposed framework on integrated people-centered healthcare. We recall that the World Health Assembly in 2009 adopted Resolution 62.12 on primary healthcare, and that the Director General was mandated to prepare implementation plans for 4 broad policy areas, including putting people at the center of service delivery. We therefore welcome the draft framework as part of the broad effort to advance primary health care. Our delegation has therefore engaged with the Secretariat, and Liberia is the lead facilitator of this resolution to submit our comments to EBR 138.2. We have worked closely with India, Liberia, and EU member states to revise the resolution, which has now been submitted as A69/B/conference/5. Our comments are mainly with the aim to give prominence to the importance of putting people at the center of delivery for the advancement of primary health care. We thank Liberia and the co-sponsors that these have been taken into account. We also recall that in 2008, African member states adopted the Declaration on Primary Health Care, as well as regional committee resolutions, which have been instrumental in our regional and national implementation on this key issue. Finally, we urge that the Director General should continue to prioritize the 4 broad policy areas identified on WHA-62-12, and we welcome the revised framework and integrated people-centered care as one of the right steps in this regard. We support the adoption of the revised framework and resolution. I thank you, Chair.
We're heading into a new era with the SDGs. Critical will be the workforce that can ably participate in the planning, design, and delivery of health services that reflect value and performance in partnership with people and communities. The SDGs will best be delivered in primary care, focusing on prevention, protection, screening, as well as intervention in illness. Services will be best delivered close to where people live and as safely as they can possibly be. It is assumed that the type of healthcare worker required will be those with a generalist scope of practice with sufficient depth and breadth of clinical and social services knowledge and skills to provide value for money. Healthcare workers will need to be able to work not only within the health system but across agencies. Germany has previously stated that their experiences showed that health workforce, when viewed as an investment that participates in the whole economic good of a country rather than a cost to one part, provides a good return on investment for the benefits of the whole community. It is therefore critical that we understand exactly what we're investing in to ensure precious health and welfare dollars are spent wisely. We support USA's call for improved data to assist analytics. In addition, the WHO could take the lead to support countries in making investment decisions by providing evidence using methodology from the disciplines of economics, such as social benefits accounting and cost-benefit analysis. In doing so, we would be able to forecast and evaluate models of service delivery and models of cross-agency initiatives in order to assist countries in decision-making around investing in workforce skill mix and service design that gives the best return on investment. Thank you, Madam Chair.
Thank you, New Zealand. I call upon the distinguished delegates of
the Russian Federation notes that this global strategy is very well synchronized with the GA's adopted Program for Sustainable Development, the Agenda 2030, and also is a universal document of the WHO on this subject. The Russian Federation, over the last few years, has been working hard to realize measures to ensure a health system which has qualified health personnel and which strives to increase their capacity.